Hi, my name is Megan. This presentation is on the spinal deformities in the aging adult. In this cadaver, who was a 61-year-old female with the cause of death being a mesenteric thrombosis and bowel obstruction, it was found that there were two bilateral posterior lumbar screws spanning from lumbar vertebra 4 to 5, indicating a spinal fusion procedure took place. A spinal fusion procedure is the connection of one or more vertebrae by fusing them together into one single solid bone structure. This procedure is commonly performed to relieve pain and pressure on the spinal cord and helping restore stability of the spine. Spinal fusion procedures are very complex and invasive. They fuse vertebral bodies together, and decompression surgery is commonly needed as well. In decompression surgery, a laminectomy is performed. A laminectomy is a type of procedure where either all or part of the vertebral bone, which is called the lamina, is removed to alleviate pressure from the spinal cord from either a damaged disc or other obstruction. Bone grafts are commonly inserted into the affected vertebral bodies, which help initiate the process of fusion. Bone grafts are commonly taken from either the iliac crest or from synthetic grafts, which can be used as well. Bilateral screws are inserted into the pedicle of the vertebra with an attaching rod, which you can see in figure 1 from the cadaver that I was working on. This helps provide extra support and strength as well as prevents movement, which helps allow the bone graft to heal in post-fusion. This procedure is performed in patients who have had ongoing pain after trying for 6 to 12 months of non-surgical treatment. Pain and pressure of the spinal cord occurs in individuals with degenerative disc disease, spinal stenosis, scoliosis, fractured vertebra, or tumors. The most common reason, though, for spinal fusion is in patients with degenerative disc disease. Approximately 352 interbody fusions are performed each year. An interbody fusion is a type of spinal fusion in which they remove the intervertebral disc. The number of spinal fusions have risen substantially over the past 2 decades. The recovery process varies for patients. Commonly, patients remain in the hospital for 2 to 3 days after surgery. Physical therapy is required to rebuild strength and motility. It typically takes 3 to 6 weeks to recover, or sometimes up to 18 months in severe cases. Approximately 80% of the patients get pain relief with spinal fusion, but the other 20% don't. To reveal the bilateral spinal screws, the dissection of a 31-year-old female cadaver's back was completed according to Grant's dissection 16th edition instructions. At the midline back, skin was removed and muscles reflected laterally. In the posterior aspect surrounding the lumbar vertebra, the latissimus dorsi, erector spinae, and the transverso spinalis were reflected up towards the midline vertebra. After dissection of the posterior lumbar spine, cleaning around the spinous process was done to help expose the vertebral bone. After the reflection of the latissimus dorsi, erector spinae, and the transverso spinalis, cleaning around the vertebra was done to expose the bone of the vertebral column. While cleaning up the lumbar vertebra, 2 bilateral spinal screws were observed in L4 and L5, which you can see in figure 1. With further cleaning, an attaching rod between L4 and L5 was revealed, providing evidence of a lumbar spinal fusion was performed. The bilateral screws appeared to be inserted into the pedicle of the vertebra, stabilizing the vertebra post-lumbar fusion surgery. The attaching rod helps prevent movement of the vertebra so it can properly heal into one large bone segment. In figure 2, this provides a radiograph of this procedure showing the fusion of the vertebra in L4 and L5. Due to the cadaver's age in the spinal fusion procedure at L4 and L5, this procedure was most likely warranted due to degenerative disc disease, which is the most common vertebral disease in aging adults. She likely had a degenerative disc between L4 and L5 due to the location of the spinal screws and the rod attachment. The other plausible causes for this procedure could be scoliosis, fractures, or other tumors, but there was no curvature of the spine seen, ruling out scoliosis. She could have had a fracture during her lifetime that resulted in spinal fusion surgery, but to rule that out, we would need to take an x-ray to obtain and examine the fracture of the lumbar vertebra. No other pathologies were seen, such as tumors in the vertebral column, ruling out tumor pathology. The screws and rod attaching provides evidence of a bone graft, which were used to help support and stabilize vertebra during the healing process post-bone graft during spinal fusion. Degenerative disc disease is a deterioration of the intervertebral disc located between the vertebra. An intervertebral disc is composed of annulus fibrosus, which is surrounds a gel-like center called the nucleus pulpus. These components have high water content and provide handling and bearing loads that daily activities provide. With aging and degeneration of the intervertebral disc, water content decreases in the intervertebral disc, and the nucleus pulpus extends into the AF, which starts the process of disc degeneration. As aging takes place, the degeneration of the IVD causes destruction of the vertebral bodies in IVD. With degeneration, the IVF contents commonly herniate out of place. This degenerative process leads to the compression of the spinal cord and spinal nerves, causing numbness and pain in that region. Degenerative disc disease is the most common vertebral pathology in aging adults. The 61-year-old cadaver was likely experiencing numbness and pain in her lifetime due to degenerative disc disease at L4 and L5, which was applying pressure and pain onto her spinal cord. Non-surgical means likely did not alleviate her pain after 6 to 12 months, which warranted her to undergo L4 and L5 spinal fusion to relieve her symptoms, helping promote a better, healthy life without pain. Thank you for listening to my presentation. I hope you enjoyed.